Smoking is a global epidemic. It is a leading cause of preventable death worldwide. Millions of people suffer from smoking-related diseases. These diseases include cancer, heart disease, and lung disease. Despite the known dangers, many people still smoke. Smoking harms almost every organ in the body. It weakens the immune system, making smokers more susceptible to infections. Smoking also damages blood vessels, increasing the risk of heart attacks and strokes. The addictive nature of nicotine makes quitting extremely difficult. Nicotine is a stimulant that creates a sense of pleasure and reward in the brain. This leads to cravings and withdrawal symptoms when smokers try to quit. Despite the challenges, quitting smoking is one of the most important things you can do for your health. Quitting smoking has immediate and long-term benefits. It reduces the risk of developing serious diseases. It also improves overall health and well-being. Cigarettes contain thousands of harmful chemicals. These chemicals enter the body with each puff. They have a devastating impact on various organs and systems. One of the most dangerous chemicals is tar. Tar is a sticky substance that coats the lungs. It damages the small air sacs in the lungs called alveoli, making it difficult to breathe. Tar also contains carcinogens, which are substances that cause cancer. Another harmful chemical is carbon monoxide. Carbon monoxide is a poisonous gas that reduces the blood's ability to carry oxygen. This can lead to shortness of breath, dizziness, and even death. Nicotine is the addictive substance in cigarettes. It stimulates the release of dopamine in the brain, which creates a feeling of pleasure. This makes it difficult for smokers to quit, even though they know smoking is bad for them. Smoking is a leading cause of cancer. The chemicals in cigarettes damage DNA, the genetic material in cells. This damage can lead to uncontrolled cell growth, which is the hallmark of cancer. Lung cancer is the most common cancer caused by smoking. Smoking also increases the risk of other types of cancer, including bladder cancer, cervical cancer, esophageal cancer, kidney cancer, laryngeal cancer, liver cancer, oral cancer, pancreatic cancer, and stomach cancer. In addition to cancer, smoking causes a number of serious respiratory diseases. These include chronic obstructive pulmonary disease, chronic bronchitis, emphysema, asthma, and pneumonia. These diseases can make it difficult to breathe and can lead to long-term health problems. Smoking damages the cardiovascular system, which includes the heart and blood vessels. This damage increases the risk of heart attacks, strokes, and other serious health problems. Smoking damages the lining of blood vessels, making it easier for plaque to build up in the arteries. Plaque is a sticky substance made up of fat, cholesterol, and other substances. Over time, plaque can harden and narrow the arteries, restricting blood flow. Smoking also increases the risk of blood clots. Blood clots can form in the arteries and block blood flow to the heart or brain, causing a heart attack or stroke. Smoking raises blood pressure. High blood pressure puts extra strain on the heart and blood vessels, leading to heart disease, heart attacks, strokes, and other health problems. Section 5. Beyond the lungs. Smoking's impact on overall health. The harmful effects of smoking extend far beyond the lungs and heart. Smoking damages nearly every organ in the body and increases the risk of numerous diseases. Smoking weakens the immune system, making the body more susceptible to infections. It increases the risk of developing type 2 diabetes. It can also lead to reproductive problems in both men and women. Smoking damages the skin, causing premature aging, wrinkles, and an increased risk of skin cancer. It weakens bones, increasing the risk of osteoporosis and fractures. Smoking can also lead to problems with teeth and gums, including tooth decay, gum disease, and tooth loss. Pregnant women who smoke expose their unborn babies to harmful chemicals. This can lead to premature birth, low birth weight, and other health problems for the baby. Smoking can also increase the risk of sudden infant death syndrome, or SIDS. Section 6. Immediate rewards. The body's rapid recovery after quitting. Quitting smoking triggers immediate positive changes in the body. Within just 20 minutes of the last cigarette, blood pressure and heart rate begin to return to normal. Carbon monoxide levels in the blood also start to drop. Within 8 hours of quitting, the level of carbon monoxide in the blood drops to a healthier level. This allows the blood to carry more oxygen. After 24 hours, the risk of heart attack begins to decrease. The lungs also start to clear out mucus and other debris. Quitting smoking is one of the best things you can do for your health. The body begins to heal itself almost immediately after the last cigarette. Section 7, short-term gains, breathing easier and feeling better. Within a few days of quitting, the sense of taste and smell begins to improve. The lungs continue to heal and coughing and shortness of breath decrease. Within a few weeks, circulation improves and lung function increases. This makes it easier to breathe and engage in physical activity. Quitting smoking also leads to a boost in energy levels. Smoking deprives the body of oxygen, which can lead to fatigue. Quitting smoking allows the body to get more oxygen, which increases energy levels. Section 8. Long-term triumph, reclaiming your health and future. The long-term benefits of quitting smoking are substantial. The risk of developing smoking-related diseases decreases significantly over time. After 1 year of being smoke-free, the risk of heart disease is cut in half. After 5 years, the risk of stroke is reduced to that of a non-smoker. After 10 years, the risk of developing lung cancer is about half that of a person who continues to smoke. The risk of other smoking-related cancers such as bladder, cervical, and kidney cancer also decreases. Quitting smoking not only improves your health but also adds years to your life. On average, people who quit smoking by age 35 live an extra 7 to 9 years compared to those who continue to smoke. Section 9. Quitting strategies. Your journey to a smoke-free life. Quitting smoking can be challenging, but it is possible. There are many resources available to help people quit smoking successfully. Nicotine replacement therapy, or NRT, can help reduce withdrawal symptoms. NRT products such as patches, gum, and lozenges provide a small controlled dose of nicotine to help reduce cravings. Prescription medications such as bupropion and varenicline can also help people quit smoking. These medications work by reducing cravings and withdrawal symptoms. Counseling and support groups can provide emotional support and encouragement. Talking to a therapist or joining a support group can help people develop coping mechanisms and stay motivated. Making lifestyle changes such as exercising regularly and eating a healthy diet can also support quitting efforts.